this is Dr. Vikash, and I have been in the medical field for about 12 years. Okay, so there are many problems in practical life encountered by people, and recently, even I had this problem, anal fissure. This is really painful, but from the medical study, okay, this is actually for educational purposes. No, it is anal fissure. Definitely you can try this one, but the problem is many people cannot differentiate. That's why the doctor consultation is required, because they can tell you if it is piles or hemorrhoids causing the problem. How will you recognize anal fissure? Okay, there are several criteria with which you can recognize. Very painful this is. So the patient will tell you, or someone will tell you that it's too painful. Even I know that this is really painful. Okay, really painful. When it is painful, especially the time when you go to toilet, the time when you shit, it's really painful. And what happens is, what makes patients worrisome is the blood in the stool. So the patient have pain, okay, and have blood in the stool. So this makes the condition dangerous looking. People, when they see blood in the stool, they are scared. Now you can see the picture. When a doctor is doing examination, do you think the patient will allow this? It's not possible, right? It's not possible for the patient to allow to do this examination, because it's too painful. They will not let you touch it. So under anesthesia, we can explore this, and we can look at this anal fissure. Okay, we can explore this. So what happens is the hard toilet, what you eat. Okay, sometimes you eat rice, okay, and you don't drink enough water, the toilet becomes very hard, and that solid hard toilet is heating the anus mucosa. You can see the toilet passing here. So this is actually, it's just a small cut on the anus, just like a small cut, just like like you have a cut on your finger, just like that. But you have to do toilet every morning, right? You have to do twice sometime. So every time you do the toilet, the cut here, the cut was also because of the hard toilet. It was so hard that it cut the blood vessel out here. You understand, right? So the problem you have to understand is, the problem is the stool itself. So in the medical book, what is written is GTN. You give a local vasodilator. This is the treatment of choice. But I tell you, if you don't make the toilet soft, it won't help the patient much. So the first criteria, even I personally, I just said, okay, start with Dupalec or lactulose. The toilets become soft. In the morning, you can eat once after breakfast. Okay, after breakfast you eat. The toilet will be just once is enough. Okay, just one time is enough. Only if you have chronic constipation, it's very hard to make it soft. You can go for more doses, but one is enough. So usually it's also available in one kind of tube, like that is better because that is already measured, and you just take out. You can take about 15 to 20 ml, okay, in the morning. So that is how we can treat it. You just have to make sure that you don't have diarrhea, okay. If you have diarrhea, then don't eat this medicine, because the problem is the hard stool, and we are trying to solve the hard stool by making it soft. So once, even my stool, when it becomes softer, it doesn't hit the anus very hard. Okay, if it doesn't hit the anus very hard, it will not cause much bleeding. Okay, and it will start slowly it will start healing. Definitely you can enhance healing by washing with the warm water, because if you wash with the warm water, this is called so-called seize bath. Okay, if you do the seize bath, it will also enhance the healing. So my suggestion is, if you want quicker relief, if you want to have a quicker relief, you can go for seize bath. Definitely you are also eating the lactulose. Okay, seize bath. and if you can apply something locally here to increase. So if it is very painful, you can apply some anesthetic gel, okay, which will ease the pain. That's also very important, because if it is painful, you are feeling very uncomfortable because of this, okay. You cannot sit on the table, you sit on the chair and work, so this is going to be a problem, right? So I think we have solved this. This is easy, this is not very hard, but the problem is to recognize this. You have to understand that the toilet will be very hard. Because of the hard toilet, people are very much scared to go to the toilet, and if they don't take out the stool, it becomes more hard the next morning, right? So that is the problem with this anal fissure. The toilet is becoming very, very hard, okay. This is the problem. That's why people complain. People will tell you, the patient will tell you that I have constipation, and another is, whenever they do the stool, after they take out the toilet, there's a dripping of blood on the stool, or when they try to wipe with the toilet paper, okay, if they use toilet paper, it stays on the toilet paper, okay. So this is it for anal fissure. The problem is to recognize. Once you recognize you have this problem, this is anal fissure, pain is there, constipation is there, and you have bleeding, you can try Dupalac and see, after the stool becomes soft, slowly it will heal. And try to use hot water while showering. You can sit down and you can just use a shower to flush that area so that it becomes hot. You'll feel much better with that. I hope it helps.